second. All right. So good afternoon. My name is Bailey Hillman. I'm the healthcare administrator here at James L. West. Today we're doing our essential caregiver visit. This is your initial training, as well as us going over some of the details on what to expect whenever you all are able to come in and get your visit scheduled. So the first thing that we're going to do is go through the training portion. Kathy Blondell is our director of nursing, and so she's going to cover a few of the things that you'll need to know on how to put on and take off the protective equipment that you're going to be wearing, as well as some etiquette and some hand hygiene. So I'm going to go ahead and share my screen so you all can see a video. If you are on a phone and you are just listening, you'll have to just listen, but then if you have questions, feel free to ask us whenever you get into the building. So Kathy, if you want to start.
Let me, to start off, before we watch this, we have to, can you hear me?
Yes.
Okay. To start off, we have to show you these videos to meet the requirement for the visitation. The state has mandated that we educate you. Even though I'm showing you this video, the only PPE that you're required to wear when you come for your visit at this time is a mask. So you'll have either a KN95, an N95, or a surgical mask with a face shield. So those are the requirements. When you put your mask on prior to entering the building, you cannot remove your mask for any reason. If you have to remove your mask, you must go outside or go to a bathroom where you're alone and take it off for whatever you need to take it off for, but you cannot remove your mask when you're in the facility. Okay. A couple of things I want to talk about these masks, and you'll see when you see how to don it. They're different shapes because people have different shapes, and these masks here are real hard to fit on larger people and men that have facial beards because it won't adhere to under the neck. So this type of mask works better if you have a facial beard and fits better. And then this one would fit everyone. So the choice is yours as to what you want to wear, as long as it fits. And if you absolutely cannot stand the N95, then the surgical mask with the face shield is a substitute for it. Okay. So if you want to go ahead and start that video, I just wanted to show you the different types of masks.
And then since she showed you the mask, just so everyone knows, it is your responsibility to get your own PPE. So you'll have to bring your own mask or face shield and surgical mask whenever you come to visit. And if you have problems getting those, just let us know, and we can help try to guide you in the right direction. All right, so here is our first video. If you cannot hear it, let me know.
How to safely put on personal protective equipment, or more commonly called PPE. We will demonstrate one way to appropriately put on or don PPE. More than one donning method may be acceptable to your facility. It's important that you receive training, demonstrate competency, and practice your healthcare facility's donning procedure. First, identify and gather the proper PPE to don, including an appropriately fitted isolation gown, a NIOSH-approved N95 filtering facepiece respirator or higher level respiratory protection, or if a respirator is not available, a face mask, a face shield or goggles, and a pair of disposable patient examination gloves. Perform hand hygiene by using alcohol-based hand sanitizer or washing your hands with soap and water for at least 20 seconds. Put on the isolation gown. Tie all ties or snap all snaps. You may need assistance from another healthcare provider. Put on the N95 respirator. When using a respirator with a nose piece, fit it to your nose using both hands. Do not bend or tent the respirator. Extend the respirator under your chin, protecting both your mouth and nose. Pull the top strap over your head, placing it on the crown. Then pull the bottom strap over your head, placing it at the base of your neck. Lastly, perform a user seal check. Do this by using your hands to cover the surface of the respirator and gently exhale, checking that the facepiece bulges slightly. Then, while keeping your hands over the respirator, take in a quick, deep breath, checking that the facepiece collapses slightly. If air escapes through the edges, readjust the fit of your respirator and perform another user seal check. Do this each time you put the respirator on. If a respirator is not available, put on a face mask. Extend the face mask under your chin, protecting both your mouth and nose. If the mask has loops, hook them around your ears. If it has ties, secure them at the base of your neck and crown of your head. Next, put on a face shield or goggles. Lastly, put on your gloves. Pull the gloves down so that they cover the wrist of the gown. You are now ready to enter the patient's room.
All right. Kathy, do you want to say anything about that?
The only thing I want to reiterate there, they said face shield or goggles. We require face shield. And at this time, like I said, we're not doing gowns or gloves, but there may be a point in the future. If you see, if we have to change our policy for it to be full PPE, then you'll know because our staff will be in full PPE. So you're going to mirror what our staff is doing.
All right, let's share. I'm going to let y'all watch this other one on how to take it off.
How to safely take off personal protective equipment, more commonly called PPE. We will demonstrate one way to appropriately take off or doff PPE. More than one doffing method may be acceptable to your facility. It's important that you receive training, demonstrate competency in removing your PPE without contaminating yourself, and practice your healthcare facility's doffing procedure. Remove and discard your gloves. Gloves can be removed using more than one technique. For the glove and glove technique, pinch the outside of the glove near the wrist. Peel downwards, pulling the glove inside out. With your ungloved hand, slide your finger under the wrist of your remaining glove. Again, peel downwards, turning the glove inside out. Discard the gloves. For the beaking method, pinch the outside of the glove near the wrist. Using your finger, pull the glove inside out and over the fingers and thumb to form a beak. With the beaked hand, pinch the opposite glove at the wrist and pull downwards, turning the glove inside out. With the ungloved hand, pull the beaked glove off, touching only the inside of the glove. Next, remove your gown. Untie all ties or unsnap all snaps. Some gown ties can be broken rather than untied. In that instance, break the ties gently, avoiding a forceful movement. Reach up to the shoulders and carefully pull or roll the gown down and away from the body. Dispose of the used gown. You may now exit the patient's room. Perform hand hygiene by using alcohol-based hand sanitizer or washing your hands with soap and water for at least 20 seconds. Be sure to clean your wrists where the edge of the glove was located. Carefully remove the face shield or goggles by grabbing the strap and pulling upwards and away from your head. Do not touch the front of the face shield or goggles. Next, remove and discard the respirator or face mask. If you are wearing a respirator, remove the bottom strap by grabbing only the strap and bringing it carefully over your head. Grasp the top strap and bring it carefully over your head, and then pull the respirator away from your face without touching the front of the respirator. If you are wearing a face mask, carefully untie the straps or unhook them from your ears and pull the mask away from your face without touching the front of the mask. Lastly, once again perform hand hygiene after removing the respirator or face mask. You have now completed the doffing procedure.
All right.
And because of the national shortage of PPE, we can reuse our face shields and our masks. So to clean if you're using a face shield, just get a Clorox wipe or a Lysol wipe and wipe your mask, your face shield down. We also have bags at the front. If you want to leave your equipment here, you put your name on it, and that way you don't have to carry it back and forth if you choose not to. And masks you have to replace if they become soiled or torn, or they don't fit your face appropriately anymore.
We do have a couple of questions. Let's just go ahead and answer these real quick. Where can we find face shields? And then Leslie responded, Costco has the face shield. So thank you, Leslie. So a lot of your health, like CVS and Walgreens, they'll have them as well. And Mr. Schumacher says, just want to make sure I understood correctly, though, that no face shield is necessary with N95s. Yes, correct. The face shields are only necessary if you're wearing a surgical mask, because it's an equivalent of an N95. All right.
Okay, so next we have to do hand washing and cloth etiquette, and I don't have a video for these, so we're just going to go through the motions. So to perform hand hygiene, why is my screen not going? It's 20 seconds with soap and water.
And try it again.
There we go. Now I've got it. Okay, it's 20 seconds with soap and water. When you initially come into the facility, the front desk will request that you go wash your hands after you're screened. You have to wash your hands with soap and water if they're visibly soiled. If they're not visibly soiled, you can use hand sanitizer, and you use the hand sanitizer the same way you use the soap and water. You have to have enough sanitizer in your hand to visibly make your hands wet. So I've got enough sanitizer, you can see it dripping off my hands. I've got enough sanitizer on here that I'm rubbing my thumbs, going between my fingers, the back of my fingers, scratching my nails across the palm of my hand to make sure there's nothing under my nails. And you do that for 20 seconds. And in about 20 seconds, the alcohol gel will dry. So you'll know you've done 20 seconds. And don't forget to do the wrists, okay? And then if you're washing your hands, it's the exact same procedure. Going over the back of the knuckles. You're using the exact same procedure. Cough etiquette. Even though you're not allowed to remove your mask when you're in the facility, I still have to cover this with you. These are the different posters that there are. You cough into your,
We can't see your screen.
okay, sorry.
It's okay.
You can't, can you see it now?
We can't see your screen. We can see you, not your screen.
Oh. Okay, can you see it now?
No. Yes, now we can. It's
Okay.
coming up.
Okay. So even though you're not allowed to remove your mask, you're going to cough or sneeze, okay? You cough into the elbow or into your mask. If you got to cough, you got to cough. You'll have to change your mask out if you cough or sneeze into it, obviously, because then your mask gets damp and all of that. But I have to go over the processes of it. You cough into a tissue, you throw it in the waste can, you wash your hands. Those are the proper etiquette. If you'll see the different flyers, we've got these hanging throughout the facility that tells you to cover your cough and sneeze, to wash your hands every time you cough or sneeze. And then there's a one down here that if for some reason your mask didn't fit appropriately or you took your mask off when you weren't supposed to, this is what happens. This is what happens in public. This is how this is spreading. These little droplets are coming out. And if you're standing closer than 6 feet to the person that's coughing or sneezing, these droplets are landing on you and you're inhaling them. Okay, so that's why it's very important that you keep your mask on at all times. All right, does anybody have any questions on any of that? There are hand sanitizing stations outside of every elevator on every floor. There's alcohol gel at the front desk. The nurses, if you need it on the hall, on the houses, there's hand sanitizer everywhere. So you won't have a problem finding hand sanitizer. And you're more than welcome to bring your own bottle if you want. And then you've also got the restroom in the residence room that you can obviously wash your hands.
The rule of thumb is usually to gel 3 times and then to get up and wash. So you don't want to gel your hands more than 3 times before you actually use soap and water. And you're more than welcome to use the bathrooms in your loved one's area. All right, Kathy, anything else before I go?
That's all I have unless somebody has questions.
Okay, it doesn't look like any questions are in the chat. We are going to go over some more information. So if you have any questions on what Kathy has covered, you can go ahead and ask.
So I think I heard her say that if you sneeze or cough when you have your mask on, then you'll have to remove that mask and then put on a different mask.
Not necessarily. So if you sneeze and it gets soiled on the inside and you need a new mask, then you would need to put one on. But if it's not soiled, then you should be okay. So if you're just coughing inside your mask, it most likely is not going to get soiled. But if you're sneezing and you have secretions come out, then you're going to want to probably change your mask out. So the whole point is it's really difficult not to want to pull down your mask to sneeze or cough. But that's the whole point in having the mask. So if you will keep the mask on, you're going to have to cough and sneeze inside your mask.
Right. So if I come wearing an N95, then I basically need to be prepared to have a backup
I would have a backup, yes.
N95 with me.
Correct.
Mm.
Unless you want to wear, you can wear a soiled mask on the inside. It still has to be form fitted to your face to protect from anything coming outside of it.
Okay.
Yeah.
Okay.
I would always have
Thank you.
2 anyway. Yes, you're welcome.
Okay.
Any other questions? That was a good question. All right, so this is a lot of information. Again, the only PPE that you're going to be wearing when you come in the first time is going to be your mask. It's going to be your N95 or your surgical and face shield. So don't worry about the gown and how to gown up and how to glove up, and those things you're not going to have to worry about at this time. And when we get there, Lee and all of our team here is going to be able to walk you through all of that. I got a question here saying, I've heard KN95s and N95 masks are hard to find. Where can you find those? So we found that Cheryl had seen CVS and Walgreens has them, or you can also order them online. So Amazon, you can get N95s and KN95s now. So good question. So I do want to go over just a few things. So initially you have to wash your hands when you get here. So I'm going to talk through the process in just a minute, and then I'm going to also introduce Lee, who's going to be the one that's going to help walk you through the process. Which I might go ahead and do that. Lee, will you go ahead and talk so you come to the front of the screen and introduce yourself and kind of tell them what you're working on?
Absolutely. Hi, it's nice to meet everybody. My name is Lee. I will be organizing the visitation, making sure that all of your paperwork is in order and everything. If you have any questions or need an outreach, please be sure to call, ask for me, or shoot me an email at lwilson@jameslwest.org.
Very good. So you might recognize Lee, or recognize her voice at least. She's worked at our front desk for a while. And so she just got, we asked her to be our liaison for our essential caregiver visits. So we're really excited that she's taken on that full-time job, and she's going to be a really good asset to all of you for your visits. So thank you, Lee, for introducing yourself. So she is going to be reaching out and getting you guys scheduled for your visit. So if you've turned in your paperwork to her, she's going to be calling you this afternoon or tomorrow to start setting up the visits. We are going to go ahead and start them this week. We're going to try to start them tomorrow just to get everybody in. And then once we get all the forms back, or the majority of the forms back, then we're going to go through the process of trying to figure out who exactly is wanting what times. And so we will be we'll be doing that. Sorry, I'm trying to get my view. There we go. We'll be doing that whenever we get all of those forms back. So the process, and then at that point we'll determine how many of you are wanting what days and what times and such. So we'll work on that and then make the announcement on what days and times will be available. And then eventually the goal is to get a system where you guys can get on and reserve your spot without having to talk to anyone. So you'll be able to see what the available days are. The plan right now is one essential caregiver per resident can be in their room at a time. So you can't visit together. If there's some medical reason that a loved one can't physically get to one location or such, just reach out to us and talk, and we'll see what kind of accommodations we can make inside the regulations. So we'll take care of that, but just one of you at a time, and you can visit the same day if you would like. You just can't be up there at the exact same time. The plan is to have 2 visitors per house. So we'll have 10 visitors in the community, which in the mornings, we're hoping to be able to get at least 20 people in and out. And then in the afternoon, 20 people in and out again. Some of you may not have been on our call the other day when we announced the essential caregiver visits. And I just want to make sure that all of you know the reason we're not just opening the floodgates and letting multiple people come into the house at a time is we're trying to keep the environment still very calm and appropriate for the individuals living in that house. And so we are doing our best to accommodate that. All right, so the other thing is, so I want to walk through the process of what it's going to look like when you come to the building. So whenever you get to the building, you will park in the front parking lot as you have in the past, and then you're going to come through the front doors. You're not going to be able to get into the front desk area. Many of you have dropped some stuff off at the front desk, so we have locked those outside doors for security reasons. We've had some reasons that we've decided to keep them locked. So the front desk will have to let you in. They'll open the doors and let you into the front desk corridor area. At that point, there's a monitor sitting on the desk. It's called AccuShield. What you're going to do is you're going to start answering a few questions. You're going to be selecting that you're a visitor to a resident. It's going to ask you to put your identification number in there, and the front desk person is going to be able to walk you through all of it. You're also going to put in there who you are visiting. This is going to help us track, per regulations, we have to track this. It's going to help us track that you are actually who you're actually coming to visit. Lee is going to meet you at the front desk. So Lee actually physically has to be there whenever you are all visiting, because she's going to need from you a hard copy of your COVID test showing that you're negative. So please do not email those. You can imagine all of us working on this. If you email Teresa or email me, our emails are flooded already. And so we want to make sure we keep it streamlined, and we have to have a hard copy of your COVID test saying that it's negative before your visit. It's kind of your ticket in to see your loved one. So Lee will take that from you and place it into a binder, make sure she has all of the signed documents, make sure you have gone through this training. He will also be checking your N95 mask or your equivalent, whatever you might have that's equivalent, to ensure that you're able to go up. She will also need to attest that you are the person that you say you are. So many of you may know Lee, but she may not know you. And so she's going to be asking for your identification. So your driver's license, if you could have that available, we'll take down your driver's license number. After y'all are coming regularly, she's going to get to know who you are. And at that point, you won't have to show your identification most likely any longer. But she does have to sign off. She signs her name saying, yes, I attest that this person is who they say they are. At that point, she has to actually escort you up to the house. So we're no longer able to give anyone badges to get upstairs alone. She has to escort you to the designated area for your visit, which right now is most likely going to be your loved one's room. And so she's going to leave you in the room. We ask that you stay in that area. Okay, it's not a time we don't get to just come out and wander throughout the house. You don't just get to come up to the nurse's station and have a conversation. If you need somebody in the room, you're going to have to push the call out button or stand at the door and ask for them to come and help. If it's an emergency, all rules broken and just go get some help. However, in most cases, you're just going to have to wait for someone to come to you. Again, we're trying to protect everyone from COVID, right? And just because you walk in today with a negative COVID test that you took on Monday does not mean that right now you're negative. Okay, it meant that you were negative at that very moment in time. It does not mean that the hour or two after you became positive or today you became positive. So we still have to protect the residents, and wandering about the community is not going to be allowed for our essential caregivers. I did fail to mention, whenever you finish signing in, it will give you a badge. So you're going to actually have a badge that you must keep on at all times during your visit. So if I had a surveyor in the building, they would be able to identify and say, oh, that's an essential caregiver, and they're here to provide care to see their loved one. In speaking of care, our CNAs and our staff are still responsible for providing all of their care. So they're the ones that need to be taking them to the bathroom. We are going to allow our family members to assist with meals. However, that is not part of the regulation. So just so everyone is clear, the only reason that we're able to do that is because our family members, right, our residents here are not able to keep their mask on due to their dementia diagnosis. And so because of that, they cannot wear a mask the entire time during your visit. However, you must keep your mask on. So you are not allowed to take your mask off. And then after your visit, and I'm going to talk more about that in a minute, but after your visit is over, so let's say that your loved one is now sleeping and you're ready to go. You can't just leave the room and come to the nurse's station and say, I'm ready to go. Will you badge me out? We're going to give you a slip of paper with a phone number on it. You have to call with your cell phone, that cell phone number, and ask Lee to come upstairs and escort you back out of the building. Again, all of the regulations and the rules that we're talking about right now are literally spelled out in our regulations. We have to follow these. They're not ones that James L. West has come up with. It has been passed down to us, and this is how we're allowed to do these visits. So you have to call Lee to escort you back downstairs. If for some reason someone is not able to adhere to the policies, then myself or Cheryl will have to have a conversation of you not coming to visit any longer. So if you would please, ensure that we're following the policies to protect not only the residents, but also our community. We, in speaking of taking your masks down, I have had some family members that have come in for end of life visits, and whenever I open the door, they have their mask off because they're trying to love on their loved one. That's not okay. All right. Remember, you were negative at the moment that you took your test, and it takes days to get your test results back. You may have been exposed or you may have become positive since then, and you could be asymptomatic. And so if you are wearing your face mask and you are positive, then the studies show that everyone should be protected. But the minute that you pull your mask down to give your loved one a kiss, either on the cheek or on the mouth, you're exposing all of us to COVID. Okay. And again, you're not going to know if you're positive or not. So I'm asking, more like begging, for everyone to please keep your masks on. Okay? I know that it's hard when you approach them if you think that they don't recognize you or they can't hear you. Please do not be tempted to take your mask down. Okay. Just remember that you're putting everyone at risk whenever you do that, even if you have a COVID-19 negative test result. So we are asking that you keep your mask on at all times.
I have a quick question.
Yes.
What if they try to kiss you, or is hugging okay?
So you do not have to social distance from your loved one. So you're more than welcome to give them a hug. And if they try to kiss you, I would let them kiss you on the cheek or on the side, but do not remove your mask. And that was kind of the point too, is I don't want anybody to panic. So if for some reason, okay, you go back the next week and take a COVID test and all of a sudden you become positive, you have to notify us that you're positive. Because at that point, we have to figure out what kind of risk we have upstairs and who might all have been exposed at that point. And so, you want to let us know if you have kept your mask on, like we're asking you to keep your mask on, the risk should be very, very low. Okay, you shouldn't have exposed anyone. So don't panic thinking, oh my gosh, now I've exposed my loved one. Okay, because the likelihood, if you followed our policies and you've washed your hands and you've gelled and you're not kissing on anyone, then you should be fine. So hugging them, getting close to them, that's fine. We are asking, and regulations state that you may not get close to or touch other residents nor our staff. Okay, and it's going to be hard for our staff because they love you and miss you just like you love them and miss them, and we all want to embrace and be excited that we're here to visit. I'm asking for everyone to resist that and to hold each other accountable. Okay, I'm telling you right now, my staff miss you. So when they see you, they may come to you just thinking, oh my gosh, I have missed you, and want to give you a hug. Please help, okay, help each other. Say, hey, air hug or elbows or air high fives. Like, we cannot get close to one another. And you're not allowed to get close to another resident. So if another resident's in the room, please get one of the staff members to come and assist that resident out of the room. So you're not social distance from your loved one as an essential caregiver. So you can hug and be close to all you want. If you want to lay down in bed with them, you're more than welcome. But again, we have to keep our mask over our nose and our mouth. Okay. So good question. That was my next point, was social distancing. And so washing your hands. So if it were me as a visitor, I would come in. Okay, you're going to wash your hands initially. You can visit with your resident anytime you feel during the visit, even whenever you get up to their room. If you want to go into their bathroom and wash your hands again because you've touched the surfaces of something going up when you and Lee are going upstairs, you're more than welcome to wash your hands in there. After your visit, I would also wash my hands. And the reason I say that is if I get on a call with all of you and say, hey, by the way, we now have a COVID positive case on Colorado House, and you just came into Colorado House and you were visiting your loved one, or your loved one becomes positive, heaven forbid. I don't want you to panic thinking, oh my gosh, am I going to be positive? If you wear your PPE all the time that you're here, and if you wash your hands as you're leaving their room, then you should be at very low risk of getting COVID-19, even if your loved one has it. So again, it's not only protecting them, but it's also going to protect you and give you a peace of mind if for some reason we have another COVID-19 outbreak here at James L. West. So please just remember to wash your hands. So again, sanitize 3 times, and then you'll need to use soap and water. All right. So I think that is all of the information that I have to cover. If you will, please make sure you're sending your documents and your questions about your essential caregiver visits to Lee Wilson. All right, Teresa is covered up in other things as our social worker, as you can imagine, and this is just adding things on top of it. So if you could please, direct all of your questions to Lee. However, I'm going to be transparent and very honest that you all have been out of our building for 7 months. Okay, things are going to look and feel differently, right? I mean, they just because of the time that's been passed. There may be clothes in their room that doesn't look like clothes that you brought 7 months ago. Okay, naturally. Again, we work in dementia care, so our clothes get mixed up, sometimes not by our doing on some houses. However, if you have a grievance, okay, and I know and we're ready for grievances. Okay, I know that there's going to be things that you may come in and think, wow, I can't believe that that's happened. If you have a grievance, please direct that toward Teresa or myself. Do not go to the charge nurse. Do not let Lee know. That needs to come to us so that we can quickly take care of it and resolve the problem. Okay, so our grievance process has always been the same. It's a form that we fill out, which Lee will have access to those. And then Teresa will get them. She will disseminate them to the proper leadership team members. And then we will take care of it and then follow up with you on what the grievance, how the outcome of it. So if you're able to go through Teresa first, that's great. If you feel like it's a concern that I as the administrator need to know about, then please come and visit with me. The nurses and the CNAs are open to you for answering questions, so feel free to ask them questions. Again, just call them to the room versus going to find them if possible. And then if you have any problems with the nursing staff, and Kathy Blondell would be the person that you can communicate with if you can't get the answers that you're wanting from the nursing team. So we are, Teresa, let me go over some questions real quick and then we can go over the roll call. So yes, there is paperwork, Carol, that has to be filled out. So there's a questionnaire that asks who your essential designated caregivers are, and it also asks what times are your preferences. So what days and then what time slots would be your preferences, because we're trying to get an overall idea of what everybody wants so we can try to accommodate everyone. So if you will reach out to Lee, actually, and she can get you those documents. So if you want to call up here, she's here just a little bit more today, and then she'll be here in the morning. I have, how long does it take to get the test results? It depends on where you go. I actually just tried Tarrant County myself to see what kind of process it is. It's pretty smooth. So whenever you drive up to Tarrant County, whenever you drive up to Tarrant County for testing, all you have to do is give them your name and your address. And if you do not live in the city, if you don't live in Tarrant County, tell them you're a James L. West essential caregiver and that this is required for you to go in the building, and they will let you go in. So Tarrant County and the Fort Worth Fire Department has been extremely kind to our building, and they're opening up testing for all of our families and all of our staff. And all you have to do, which trust me, you want to drink some water 30 minutes before because it's a lot of spit that you have to spit. So you have to spit into a vial. And you sit on your own and you just spit until it gets up to the line, and then you shake a blue solution in there and then you drop it into a bag. It is very easy. There's nothing going up your nose. There's nothing in your mouth. It's quite simple, but you definitely do want to drink. So if you have dry mouth or something, I would go to NRH versus going to the Fort Worth testing results. So we've had over the last couple of days families saying, oh, they won't let me come in. I can't register online. Don't register online. Okay, just find a site, drive, make sure you go during the times they're open, drive up, and then tell them you're a James L. West family and they'll let you right in. If they don't, then call the building and we'll discuss it with them. And then North Richland Hills is also a really great option. They don't care where you live or who you are. You can drive up in there, you just swab the insides of your mouth, and they do the same thing, you put it into the bag, and then you get all of your results electronically on your phone by email or by text. So those are both really great options. Again, you have to have a hard copy when you come in order to get in, so please don't email those to us. Our staff are not parking in the back. The reason that we're not parking in the back yet is because we are having to screen everyone. And so we don't want to miss anybody coming in for their shift. We definitely do not want to miss any of our vendors or our visitors or even our hospice families. So the plan is that some of us in management are going to be parking in a different parking lot that's close to us in order to open up some spots. We'll see how that works. And then we have some machines coming in that we're waiting on to place in the back for our staff. Once those are in, we'll be able to open up that back parking lot again. So if it is full, you are able to park. There's a white building, we call it the Wave building. It's on the other side of the parking lot. You can park on the other side of the bushes as long as you don't park underneath the covered parking. So you're more than welcome to park there for now. First Presbyterian is usually very willing to let you park over there. You just need to let the front desk know that you did so we can call and alert them that you had to park there. Otherwise, they may tow you. If you have your own badge, please do not bring it back to the building. Okay, again, you cannot go upstairs on your own. So don't even worry about bringing your badge yet because you're not allowed to go up on your own. Do you think we'll get to come soon enough to go ahead and go get tested? Yes. So we're starting visits tomorrow. So if you turn in all of your paperwork and go ahead and go get tested, then the likelihood of you getting to come in is very high. We are encouraging you to go ahead and get routine testing. So pick a day. If it's Wednesday, pick Wednesday and say every Wednesday, I'm going to go get my COVID test. So anytime I need to go in and visit my loved one, I'm ready to go. I don't have to wait on test results. The paperwork is not one per, yes, it's one per family. And then if you're essential caregiver, you have to sign another document that saying that you've read the rules. So it needs to be two. Both of you have to sign your own separate document. That makes sense, Ben? So your mom needs to sign one and you need to sign one.
What page is that?
It's the last page of the policy.
Okay. And the first three pages I can take anywhere, regardless if because I'm in an interesting place. I'm in Denton, Dallas, and Tarrant. So if I go to a Denton County one, I just show them the paperwork and.
Yes, you should be able to say I'm an essential caregiver and they should be able to let you test. If they don't, I would try to find a Tarrant County one because we do have a agreement with them.
And is it, and I'm sorry, but did I hear any Fort Worth police station? I mean,
No. There is a list that Teresa has sent out of specific places that Tarrant County has them. And it's the fire department that's doing them, but they're not at the fire stations.
Okay.
There's 4 locations that are stationed and then there's a few that move around. So you'll want to look those up.
Okay. And do you by any chance know if the station, is it one on each corner of Tarrant County?
Yes, they've spread them all out.
Okay.
Yeah, so you'll just want to find the one closest to you. All right, can we bring things like decor for rooms and yes, and food? So I would ask that, so she's asking for the house staff, so for the team members. I would ask that right now we just really focus on the residents. We have done a lot of morale building and everybody's been donating things like, you know, a lot of money. Like this week we have breakfast burritos for the staff. So all shifts are going to get breakfast burritos. So you guys have been donating and giving. So I would ask that you would just focus on your loved one for right now. It also makes our staff are not allowed to eat up on the houses. Okay, so they can't eat up on the houses because what does that require for them to take off their mask? And so we ask that they don't eat out in the common resident areas. They can drink. So if you see somebody taking a drink, they can take a drink and put their mask right back on, but they're not allowed under their mask. They're not allowed to take their masks off to enjoy a meal. So I ask that you would refrain from bringing anything for the staff right now. Instead, just show them your love and encourage them and give them words of encouragement and positive vibes. However, for your loved one, you're free to bring whatever you would like. So COVID-19 with research is shown not to carry on surfaces. So you're more than welcome to bring, food items if you want to bring them a shake or some ice cream, or if you want to bring them lunch from Chick-fil-A, they can have all of those things. You are just not allowed to enjoy a meal with them. So you can't have a meal with them because you would have to take off your mask. And again, it's not allowed to have those things, but we're opening it up because we have dementia care. So if anybody asks you, so if I have a surveyor in the building when you're here, the answer is the only reason my loved one's getting to eat is because they refuse to wear a mask. And so since I'm here, I'm assisting them. Essentially what the state's doing is treating you like our team members is really what they're expecting you to have the same training, the same understanding, and be able to answer all of their questions just as if you were one of the team members. So Lee's email is lwilson@jameslwest.org. So lwilson@jameslwest.org. So Teresa, will you type that in the chat box for everyone if you don't mind? All right, so if you don't come every week, do I still need to get tested every week or just before I schedule to come to get a visit? You can, if you're just going to come periodically, then you can just schedule, get tested before you come. So you don't have to worry about getting tested every week. So if you are coming every week, which I know many of you are going to want to get on a routine of visiting, then you're going to want to get on a routine of testing as well. So you're allowed to visit up to 2 hours or longer or shorter, determined by us as clinical team members. So if for some reason we feel like your loved one or we are not able to accommodate you for a longer period of time, we can cut the visit shorter. However, the state says that we can do 2 hours, or if we feel like you need a longer visit, then we're able to allow you to do a longer visit. Please don't get wrapped up in the time frame. And we talked about this on our last visit. I want to do what's best for your loved one. Okay, so if your loved one's able to tolerate 10 minutes, then your visit may be 10 minutes. If they're able to do 30 or 45 or 2 hours, whatever your loved one is able to accommodate, and whatever they can tolerate, that is what we're asking you to do. So don't get stuck on, I've got to use up my 2 hours because this is the only visit that I get. That's not going to be the case. So these are going to be routine visits. Okay, these are going to be open. So you guys are it, right? You are the 2 people that are designated for your family member and you're not able to be changed. So they're relying on you and you're going to have routine visits. So you're able to schedule them and we're going to try to get it to where it's a routine thing to hopefully you'll be able to come at the same time every week. Or if you're not able to, at least come once or twice a week to see your loved one. Do you think we'll be able to have weekly visits? Yes. And set to a schedule. That's the goal, is to get everybody in who wants to get in. And many of you are out of town and that's perfectly fine. So when you get ready to come in, we're going to get you scheduled and get you in here. If you live in town and you're used to visiting routinely, then yes, we want to accommodate whatever is best for you. We are going off of the documents that we have currently. So Lee's starting with the people who've already turned in their stuff. So the later and the longer it takes you to turn stuff in and get all of your part completed is going to be up to you as far as when your visits get to start.
Bailey, if I may say something real quick.
Yes.
For the family members who have already sent in paperwork to either Bailey or Miss Teresa, they've forwarded it on to me.
Yes.
And so if you don't get a call from me by the end of this week, don't be afraid to reach out and double check that we do have your paperwork. If there was some kind of mix up, I'm happy to get you the forms that you need to refill out.
Yes. So I just want to give a few more tips before we jump off. I don't see any more questions, but I'll leave it open. So if you have any more, I want to remind you what Holly had mentioned on our family call. So whenever you get here, please remember that your loved one may not know that you haven't seen them in 7 months. Okay, you need to walk in as if you have seen them yesterday. So walking in and with a happy tone and excited to see them. Some of them may know that they haven't seen you in a while, but please don't ask them if they remember you, or if they know who you are. Don't try to get them to guess your name. Okay, they just make it a very enjoyable visit. Okay, so as you walk in, just try to remember, like, I need to pretend and act as if I had seen them yesterday. And many of you have talked to them on the phone, and so this is going to be a very sweet reunion for you, but they might not remember that you haven't been there. And so please don't cause them any more stress. We also are going to need to really watch clinically how they do after you leave. Okay, and so our team is very good at making sure we monitor their behaviors, make sure we watch if they're anxious. If it becomes where they're not able to handle the anxiety that it's causing, we may adjust the time that you come. We may adjust the amount of time that you come. So if you come every day or 3 times a week and it's just causing them so much stress and anxiety, we're going to ask you, and clinically, we're going to be able to say, hey, I don't think they're able to tolerate this right now. And so let's try it a different time or a different frequency. So please be open And remember that, we're all kind of getting this process started. So the more we communicate and the more we're open to suggestions, the better this is going to go for those that we care for, right? For our loved ones. And so please remember that. We also have a tips and trick sheet that's going to go out by email this evening. I actually received it in my email to approve right before I got on this call. So I'm going to approve that, look over it, approve it, and then they'll be sending that out to all of you. And then we also have a card for whenever you leave that Lee's going to be giving you to give you some information as to the emotions that you're going to be having. Okay? Because again, it's been 7 months. And so they're not going to look like they did 7 months ago. And even though you've seen them on video, it's very different. So we want you to be prepared for that. If for some reason, again, the grievances go to Teresa, but if for some reason you find that emotionally it is very difficult for you, and it may be for some, and that is perfectly okay. Holly Glover is our counselor here on staff. She's part of our education department. She is available to visit with you. We're also going to be giving you a flyer for our marketplace chaplains. They've been working with us through this entire process. They've been praying over us. We've been praying over the process. We've been praying for all of you. And so they're available at any time by text, by phone. They even have an app that they will communicate with you through. So you have resources available during this time if it's difficult. And it may be very difficult for some. And so we want to make sure we have all of those resources available. The video chats are going to continue for now. We are going to be phasing those back out. Those are not as beneficial as the in-person visits. So we're going to encourage people to come in and be an essential caregiver and to visit their loved one in person if they're able and possible, if it's possible. And so right now we're going to continue them, but we will not do a video conference on the same day that you have an essential caregiver visit. So if somebody is here visiting with them, then there will be no video calls. So that's kind of how we're going to start phasing those back out. And then eventually the goal is to get back to where we're having in-person visits, because we all know that that's a lot more beneficial for our loved ones than the video calls, especially in the situations that we're in here. All right, so I don't see any other questions coming in. So Teresa's going to take a roll call. So Teresa's going to take roll call. Doug, we can talk about his two siblings out of town. So if they have someone out of town for now, we will do FaceTime visits, but not on the same day that you're here in person visiting. Again, we have to remember that we're trying to, our loved ones are going to feel the difference in the environment, right? They felt the difference whenever we cut out all of the visitation. They felt the difference whenever we started doing video calls and not in-person calls. They can feel, even though they can't communicate it, we can see it very apparent in many of them, the environment. And so too many visits in one day may have a negative impact. And so we're going to do what's clinically best for your loved one. And so if it's best that we do all of the visits in one day, then that may be determined. But right now, the plan is to just do one type of visit a day versus trying to do a bunch of different types of visits. So good question, though. All right, so Teresa, if you want to start roll call, I know we've kept y'all on for an hour now, so I will stop the recording before we do.